Hello everyone, and welcome to the Well Baby channel. The focus of today's talk is oral contraceptives, also known as birth control pills, and we will look at their effectiveness. Make sure you stay tuned until the very end because I'm sure it will contain a lot of helpful information for those of you who may not be quite ready to start a family yet. Make sure to subscribe to the channel so that we can provide the best possible assistance and support for you. Now, without further ado, let's go right into the video. In this video, we are going to talk about the effectiveness of birth control pills, although there are other types of birth control. The effectiveness of birth control depends on the type of contraception used and how consistently and correctly it is used. Here are some common methods and their typical effectiveness rates, briefly outlined. The pill is highly effective when taken consistently and correctly. The typical failure rate is less than 1% with perfect use, but with typical use, which includes occasional missed pills, the failure rate is around 7%. Other types of contraceptives include: male condoms are about 98% effective with perfect use but have a typical use failure rate of around 13%. Female condoms are slightly less effective. The contraceptive patch is a hormonal contraceptive that is about 99% effective with perfect use. The typical use failure rate is around 7%. The contraceptive ring is a vaginal hormonal contraceptive with a similar effectiveness rate to the pill. It's about 99% effective with perfect use and has a typical use failure rate of around 7%. There are also injectable contraceptives, or Depo-Provera shots. The injection is about 99% effective with perfect use but has a typical use failure rate of around 4%. Intrauterine devices, or IUDs, are highly effective, with failure rates of less than 1% with both copper and hormonal IUDs. Subdermal contraceptive implants are about 99% effective with perfect use and have a typical use failure rate of less than 1%. It's crucial to keep in mind that a variety of factors, such as individual adherence, medical conditions, and interactions with other medications, can affect the effectiveness of birth control methods. Additionally, protection against sexually transmitted infections, STIs, is not guaranteed with all forms of birth control. Using condoms in addition to other methods can provide both contraceptive and STI protection. In general, birth control pills are considered safe for most women when used as prescribed and under the guidance of a healthcare provider. However, like any medication, they are not without potential risks and side effects. It's important for individuals to weigh the benefits and risks based on their individual health and medical history. Here are some considerations regarding the safety of birth control pills. There is a small increase in the risk of blood clots associated with the use of birth control pills, especially in women who smoke and women over the age of 35. This risk is higher in individuals with certain health conditions, such as a history of blood clots or cardiovascular disease. There is ongoing research on the potential link between long-term use of birth control pills and the risk of breast and cervical cancers. The relationship is complex and may vary based on individual factors. Birth control pills may have a minor impact on liver function in some women. Regular monitoring is advisable, especially for those with pre-existing liver conditions. Women with a history of migraines, particularly aura, may be at an increased risk of stroke while using combined hormonal contraceptives. There is some evidence suggesting a potential link between long-term use of birth control pills and a small decrease in bone density. Although the clinical significance of this is still debated, there are benefits to taking birth control pills. Birth control pills are highly effective at preventing pregnancy when taken as prescribed. Birth control pills can help regulate menstrual cycles, reduce menstrual cramps, and manage conditions like irregular periods and heavy bleeding. Some birth control pills are known to improve skin conditions, such as acne. Long-term use of birth control pills has been associated with a decreased risk of ovarian and endometrial cancers. Who should stay away from or only use cautiously? Women who have a family history of blood clots, stroke, or heart disease. Those who smoke, particularly those who are above the age of 35. Women who suffer from specific liver disorders. People who have a family history of a certain type of cancer. It's crucial for individuals to have an open and informed discussion with their healthcare provider before starting or changing any contraceptive method. The healthcare provider can assess an individual's health history, discuss potential risks and benefits, and recommend the most suitable form of contraception based on the individual's needs and health profile. Regular checkups are important to monitor any potential side effects or changes in health. Be advised that for the most accurate information about a specific method and individual circumstances, it's advisable to consult with a healthcare provider. They can offer personalized advice based on an individual's health history and preferences. The 1% failure rate associated with many highly effective contraceptive methods, such as birth control pills when used perfectly, refers to the percentage of women who become pregnant during 1 year of correct and consistent use of the method. It's important to note that this failure rate does not imply a single instance of failure but rather a statistical measure over a large population. Some common factors that contribute to the 1% failure rate are user error. Even with the best intentions, users may occasionally forget to take a birth control pill or may not take it at the same time every day, leading to a decreased effectiveness. Certain medications, such as some antibiotics or anticonvulsants, can interfere with the effectiveness of hormonal contraceptives. If a woman vomits shortly after taking a birth control pill, or experiences severe diarrhea, the absorption of the contraceptive hormones may be compromised. Some methods, like birth control pills, require starting a new pack promptly after completing the previous one. Delays in starting a new pack can reduce effectiveness. Certain health conditions or lifestyle factors may affect the efficacy of hormonal contraceptives. For example, smoking, obesity, and certain medical conditions can impact the overall effectiveness. It's crucial to understand that the failure rate is an average over a large population, and individual experiences may vary. With typical use, which includes occasional errors or missed doses, the failure rate for birth control pills is higher, usually around 7%. This emphasizes the importance of using contraceptives consistently and correctly to maximize their effectiveness. For those seeking the most suitable contraceptive method, it's advisable to consult with a healthcare provider. They can provide guidance based on individual health considerations and preferences, helping to choose a method that aligns with the user's lifestyle and ensures effective contraception. Regular checkups with healthcare providers are also important to address any concerns and monitor the ongoing effectiveness of the chosen contraceptive method. Birth control pills, when taken correctly, are highly effective at preventing pregnancy. The typical effectiveness of birth control pills is around 91%, which means that in a given year of use, about 9 out of 100 women may become pregnant. However, with perfect use, meaning taking the pill consistently and correctly without missing any doses, the effectiveness can be as high as 99%. It's important to note that various factors can influence the effectiveness of birth control pills. Taking the pill at the same time every day is crucial for its effectiveness. Missing doses or taking pills at irregular intervals can reduce its efficacy. Some medications, such as certain antibiotics or anticonvulsants, can interfere with the effectiveness of birth control pills. It's important to discuss potential interactions with a healthcare provider. Certain health conditions, such as vomiting or diarrhea, may affect the absorption of the pill and reduce its effectiveness. Different people may metabolize medications differently, which can affect how well the pill works for them. It's important for individuals using birth control pills to follow the instructions provided by their healthcare provider or the product's packaging. Additionally, individuals with concerns or questions about their contraceptive method should consult their healthcare provider to ensure they are using it correctly and to discuss any potential issues or alternative options. Make sure you don't miss any of our other interesting sessions by not tuning in to the ones that are mentioned right here on our channel. Like, the developmental milestones are infant to toddler and homemade baby food recipes. You won't want to miss out on those opportunities. Birth control pills, also known as oral contraceptives, can have various effects on a woman's body, both short-term and long-term. It's important to note that individual responses to birth control pills can vary, and not all users will experience the same effects. Additionally, new formulations of birth control pills may have different effects compared to older versions. Here are some common short-term and long-term effects. Implications in the short term include the regulation of the menstrual cycle. Birth control tablets are frequently provided to patients in order to regulate menstrual cycles, lessen the severity of menstrual cramps, and manage disorders such as heavy bleeding and irregular periods. Women who take birth control tablets may notice that their menstrual flow is reduced, resulting in lighter menstrual cycles. It's been shown that certain birth control tablets can help treat skin issues, including acne. It has been found that women who take birth control pills for a longer period of time have a lower risk of developing ovarian and endometrial malignancies. Birth control tablets can help decrease symptoms of menstrual pain and discomfort, which can lead to an improvement in menstrual pain. Long-term effects. Bone health. There is some evidence to suggest that there may be a link between the use of birth control pills for a long period of time and a little loss in bone density. However, the clinical importance of this is still being contested. This link could have long-term effects on bone health. The use of birth control tablets has been linked to a marginally higher risk of blood clots, particularly in women who smoke and in women over the age of 35. This association has been made in the context of cardiovascular health. However, more recent formulations that use lower hormone dosages have significantly reduced this risk. In most cases, a woman's fertility returns rapidly after she stops taking birth control pills. Nevertheless, there are individual differences that can occur. Risk of breast cancer. Birth control pill use and the development of breast cancer are two complicated relationships that may depend on a person's age, family history, and how long they have been taking the pills. The investigation into this subject is still going on. The use of birth control tablets for an extended period of time may have a marginally negative effect on the liver function of certain women. Regular monitoring is recommended, especially for people who have liver disorders that are already present in their bodies. It's important for women considering or using birth control pills to discuss their individual health history, concerns, and potential risks with a healthcare provider. Regular checkups and discussions with a healthcare provider are crucial for ensuring that the chosen method of contraception is appropriate and effective for an individual's unique health profile. If a woman should become pregnant while taking birth control pills, there is a general consensus among healthcare professionals that the pills themselves do not cause harm to the developing fetus. Birth control pills work primarily by preventing ovulation, thickening cervical mucus to impede sperm movement, and altering the lining of the uterus to make it less receptive to a fertilized egg. Once a woman is pregnant, these mechanisms are not relevant to the pregnancy. However, it's important for a woman to stop taking birth control pills immediately upon discovering that she is pregnant. Continued use of birth control pills during pregnancy is not recommended, and it's crucial to inform a healthcare provider promptly. While the pills themselves are not considered harmful to the fetus, discontinuing them is important for appropriate prenatal care and to avoid any potential complications. If a woman unintentionally continues taking birth control pills during the early stages of pregnancy, it's generally not a cause for panic, as many women have unknowingly taken birth control pills in the early weeks of pregnancy without adverse effects. However, healthcare guidance should be sought promptly. Every pregnancy is unique, and there can be individual variations in response to medications. Therefore, seeking guidance from a healthcare provider is essential in any situation where pregnancy occurs while on birth control pills. They can provide personalized advice based on the individual's health status and the specific circumstances of the pregnancy. Many thanks for watching today. Please like and subscribe if this information is helpful. As always, please leave any comments or questions below. Good luck and abundant blessings to you.